she was wheelchair bound.
Yeah.
She could stand up, she couldn't walk, she totally lost all the strength on the legs. 51 years old, 6 months.
Again, pain, they're going to take action. But numbness or weakness, they don't take action, when in reality it should be the opposite. If you're seeing loss of function, that's a much bigger deal than just pain.
I think that's the saddest thing for me to say, I cannot help you. 6 months, why you didn't go to the emergency room? Like, you cannot walk. You are ignoring it. Yeah, it's not just like it's just gonna go away.
When you hear that, it's only numbness, what's your first thought?
My guest today is Dr. King-Logsdon, a neurosurgeon at Banner Health, originally from Turkey, who has practiced on 2 continents, served in the Air Force, was deployed to Afghanistan, and who since the 6th grade knew that this is exactly what she wanted to do with her life. In this episode, she explains why loss of function is more dangerous than pain, why surgery is not the same as fixing your pain, and what it actually takes to know when someone's life depends on surgery. This is Doctors Unscripted.
All right, so very excited here to have Dr. King-Logsdon here with us. She is a neurosurgeon with Banner, and we are so grateful to have you here on the show today. So first off, we were just talking about this. A lot of people don't know necessarily the difference between a neurologist, a neurosurgeon, and an orthopedic surgeon. Could you break down what is the difference and what is a neurosurgeon compared to the other 2 professions?
Let's start from the neurology and neurosurgery. Neurology does not do surgeries, and neurologists take care of the brain and nerve diseases, and it is all medical treatment. Some neurologists follows the degenerative spine disease or the back pain, neck pain, everything else, but when it comes to neurosurgery, it is a surgery, right? So we take care of the brain tumors, we operate on the brains, we operate on the spine, it is broken, it is an infection, it is a cancer. We take care of all those stuff because it's a physical stuff. And most of the time, neurosurgeons doesn't have to do a fellowship for the degenerative spine disease. Now I think trend is they like to get the fellowship, but the neurosurgery residence 7 years. So in 7 years, you know how to read the images, you know how to operate, and so that's the neurosurgery. For orthopedic surgery, but they take care of bone, right? And then the bones are anything else, including the spine. But orthopedic surgeons have to do a fellowship to treat spine diseases, but they are surgeons too. So training a little bit different, and then most of the time actually we work together also, and because we are treating the same thing, but if it comes to anything touches the nerve or the pathology of the nerve or the tumor of the nerve and everything else, orthopedic surgeons doesn't take care of it. It's all us.
Got it. So kind of to recap what you said, a neurologist is going to work primarily with medication and managing neurologic disease. A orthopedic surgeon is going to do surgery on bones. Primarily, it could be, depending on their specialty, spine or joint, right? And then a neurosurgeon is going to work on the spine as well, but also they can do surgery on nerves and the brain. And so if anybody's ever heard of a brain surgeon, that's a neurosurgeon, right?
That's right.
So when they say if you're as smart as a brain surgeon, they're talking about you, is that right?
That's right.
Okay, perfect. So I'd love to hear a little bit about your background, how you chose to do neurosurgery and how you got into this specialty.
Well, I decided to become a neurosurgeon when I was 6th grade.
Wow.
Because I was ice skating and I hit my head, and my dad was Air Force pilot, so I went to the neurosurgeon. And then at that time, there is not even CAT scans, just x-rays and all stuff. So, and then he examined me, and then he looked at the films, and he said, nothing wrong with me. And then I thought he was the smartest guy ever. Just looking at the films and examining me, and then he knows what's going on with my brain. So it started like this, and it never changed. And so I am from Turkey. That's why the accent. And so I did do medical school in Turkey. I did do 6 years of neurosurgery residency in Turkey. I finished that one. Then I came to United States and did a fellowship. I had to redo the internship and the
Wow.
residency. And
So
then
you did it again here.
I did it again. I got 1 year credit. And then after that, when I was a resident at the University of New Mexico, I joined the Air Force. So I did the 3 years of Air Force, got deployed, went to Afghanistan, then joined Banner, and then I've been with Banner 15 years.
That is fantastic. That's an incredible story. So, I mean, getting that education in Turkey and then again having to redo it here in the U.S., you have, I'm sure, an incredible breadth of knowledge. But it only grows as you get out of school and you continue to educate and you continue to get better as you follow up on continuing ed. What do you feel like through all of this has been your favorite part about being a neurosurgeon? What's your favorite thing about being a neurosurgeon?
Well, everything. But I like to see the patients, they are alive and they are happy, and then you have something to do with. It's just like, especially not just the chronic diseases, with the neurosurgery, I do traumas. So I actually really save lives, like people, And
what kind of things come in on trauma?
Yeah, it's just traffic accidents, motorcycle accidents, so they have brain bleed, they have broken bones, the spine or head or something that we fix and we take care of them. And then the satisfaction is totally different than the chronic pain patients or, long-standing diseases.
Yeah.
And that's unbelievable gratitude.
Yeah, I mean, frequently with patients like that, as they come in, if you're not there, they don't make it.
Yep.
Right? So they're in a car accident, something like that, and they call you in to be able to do surgery on those extremely critical cases. And that's why it's so rewarding, is because you're saving lives in that moment, right?
That's right. And I am in Banner Desert Medical Center, and all the east side Banner facilities, we get patients from Maricopa, we get patients from Payson and Globe, because there's no neurosurgeons. So for getting care by the neurosurgeon, it has to be trauma center.
Got it.
And Banner Desert is one of the trauma centers. So we get lots of patients, and we get to take care of lots of patients from this side.
So I want to go back for a moment to the fact that you did schooling in Turkey as well. So Turkey, a lot of people don't know this, Turkey has an incredible medical program there.
Yep.
Medical education. In fact, a lot of Europe end up going to Turkey to get their surgeries.
That's right.
And so would love to hear kind of the difference of what you saw when you were doing your education in Turkey versus your education in the U.S. What are some of the biggest differences that you saw between the two programs?
Well, one of the best neurosurgeons in the world, Dr. Yaşargil, is a Turkish guy. And Turkey, the medical school that I went, they have one of the biggest intervention radiology program. Like, it is very good, competitive with the Europe, United States. The neurosurgery, I think we are the same, just that teaching is different.
Got it.
And because, it's just you do the residency in the teaching hospital, so there are lots of attendings. There are lots of junior faculty, senior faculty, they want to do the surgeries. So it is not much hand-on when you're a resident, as
You
much
were
as I
there.
would. Turkey.
In Turkey.
When I did fellowship in the United States, I did it in University of Arizona in Tucson. And it was the actually most hand-on was ever. And when I got the residency, I'm already fully trained neurosurgeon, and then you just keep doing surgeries.
Wow.
And hands-on is good. You gotta do whatever you're supposed to do, and you get better at it. It doesn't say it on the books how to do the surgery, you gotta do it. So I think it was the biggest difference. Knowledge-wise, I think we are the same.
Very similar. So main difference is you got your hands on working with patients much sooner in the program, and then repetition.
Yep.
And as you said, repetition is what really gets the skill. You can know everything in the world, but the first time that you actually have to cut into a patient, it's still the first time that you're going to have to do that. And then as you do more,
That's
you get
right.
better.
Yep.
Okay. So, no, that's fascinating because I think a lot of people don't realize, I know at least here in the States, some of the great medical programs around the world. So it's really great to hear, your experience there. I think they actually created in Turkey multiple surgeries that we use here in the U.S. was it the hernia surgery, I think, was created in Turkey? At least one of, I know a doc that told me that. I don't know if it's true.
I don't know.
But there's, they do a lot of, obviously, the things that people have heard of is a lot of hair transplant and other stuff. But they actually have...
Yeah, dental and then the hair. As
Dental
far
and
as
hair.
I know, in Turkey, it is like really advanced programs. I'm from Istanbul.
Okay.
So Istanbul is one of the biggest cities in Turkey, but capital is Ankara, which is the middle of the Turkey. And there are lots of big cities, but the most of the medical advancement, I think, is Ankara and Istanbul. There are other cities too, but not as much. So people goes there, and then they treat it like they're going to spa and then getting taken care of.
Well, that is one of the things that I think is the most startling. I know a bit about the healthcare system in Turkey, and the hospitals are beautiful. Like, they are like a spa. Like, I was absolutely blown away. Like, the difference in some of the hospitals here where you go in and it's
Well, they are private
clean
hospitals.
and sterile, but the private hospitals
Private
there are
hospitals, yeah,
incredible.
well, I didn't see none of them because when
You were
I
in your
was in
residency, right?
Turkey, it was all universities and old hospitals. You know, the Turkey is just most of the people has government insurance.
Got it.
So and then the universities and the old kind of hospitals and everything belong to government. So I don't remember being that nice. Then the private universities start to pop up, and then the private hospitals start to pop up, and everything. And then I saw pictures, I saw videos. It's gorgeous
Yeah,
there.
like 5-star hotels is what the hospital looks like. I
Yeah.
was blown away, but private hospitals are different than public hospitals.
That's
for sure.
right. That's right.
So going back to kind of neurosurgery and patients, I know a lot of times people ask, who should see a neurosurgeon? We talked about the difference between neurology, neurosurgery, and even orthopedic surgery. We obviously refer a lot of patients to neurosurgery. It's a really important thing, but I'd love to hear your perspective of what type of patient should really seek out a neurosurgeon.
So it is all about the triaging the patient, right? So that's why we've been trying to educate PCPs, the family practitioners, and primary care, because they are the first door. They have to go see their primary care physician. And when they got it, then there's certain things that they need to do if they have neck pain, back pain. So these are all simple things that actually primary care physicians very well aware, and then most of them know what to do, like physical therapy or the pain management. And now the insurance companies doesn't even authorize imaging without doing all those conservative management. So we are not there yet. So I am at the end of the road. That's just the gate. So with those fails or you start getting weak, you start getting numbness, there is something really bad. It is not just about the pain. Pain says there's something wrong, but when you start losing the function, there is really something wrong.
Absolutely.
Then you get an imaging study, and then imaging study shows something. And most of the time, so I tell all my patients, so degeneration or the arthritis, it is wear tear. And this means whatever that you do in life, job, body habits, your habit, your health, sports, military, and so everything affects the body. And then the age is one of the other things. And so when everything affects the body, that wear tear affects the bones, the discs, the joints, and everything else. And spine has zillions of joints. And so it is not just the knee or the elbow or the shoulder. So it could be so many things abnormal. So main thing though, there is no such a thing that I can take the old spine out and put a new one in. I tell
There's no spine replacement surgery.
Exactly. There is no spine replacement surgery. It's just like there are still changes. What I tell my patients is like if there's a compression on the spinal cord or the nerves that physically we see on the imaging, that we take care of it. Same thing with the brain, right? If there's something that we can physically take it out or repair it or do whatever that we need to do, that's the surgical part. So at that part, when you get the imaging and something is abnormal, it goes both ways. Because if your primary care physician does not know what those abnormalities means, you can send the patient to neurology, and neurology will say, okay, this patient might need surgery, and then they see the surgeon. So 70% of the people that we see in the clinics, they are non-surgical. Okay?
They're sent to you, but
they
they don't need
to me,
surgery.
they do not need surgery. But it is good because as a specialist, so I can explain them that they can understand what is wrong with them. Because when you start Googling your symptoms, it goes from 0 to 100 without...
Absolutely.
So at that moment, then we talk. And most of the people thinks the pain is something that surgeon can fix. And that's not true. Yes, we can fix up to 70%. If it is broken, that's why it's hurting. If it is, not doing its job, that it's hurting, that yes, we can address all those issues. But most of the time when I tell the patients, like, okay, so I'm doing this to first take the pressure off, whatever I'm gonna take pressure off. And then if it is not stable, I will stabilize it. And if it is causing the pain, then now I fixed it. But most of the time, it is stable. There are lots of wear tear, and then they will still have the pain.
Well, and I think that's a big thing that people don't realize is that they say, I'm in pain, I got sent to the surgeon, they're going to fix my pain. But typically...
Everybody wants to get fixed.
They want their pain gone, and that's a good thing, and we want to work towards that. But yeah, as you said, the primary thing that I've heard from talking to multiple neurosurgeons is, it breaks down to this. If we see compression, we decompress. If it's unstable, we stabilize. And that's a lot of what's done is they're not, and yes, that could be causing the pain, right? The
Definitely.
decompression, all of a sudden it's like, okay, now I can breathe, it's better, the pain goes away. But you're not doing it to treat the pain, you're doing it because there's compression and it needs to be decompressed. And a result may be that the pain goes away, right?
That's right.
And so oftentimes, like, there's, people hear about, well, people still had pain after back surgery. And that's a real thing, that, like, it happens a lot more often than we'd like. However, that doesn't mean the surgery wasn't successful.
That's right.
If they needed a decompression and it was decompressed, that's a successful surgery.
That's right.
Doesn't mean the pain goes away.
It's just that that's why in comes the informed consent. So you have to educate everyone that you are going to operate. Tell them what is the indication for surgery, what will get better, what might not get better. All my discussions, we are not doing for the pain. Hopefully it gets better, but there's a chance it might get worse. The worst thing that we are doing this, if it is just for pain, it might not work. And there's other things, like when people get surgeries, since the surgery, my foot is weak. But actually it was weak before. But since the surgery, I am having this numbness. Most of the time they had it. It didn't get better. Because why did you have surgery? Then when you dig, and then no, it was worse. And then it got some better, but it didn't get better. It didn't just disappear and you go back to 25-year-old yourself. You know what I mean?
So let's do this. Let's talk for a moment. Like, we use words like compression and stabilization, and many patients may not know what that is. So what type of things can happen in the spine that may need decompression or causing compression? All
right, so spine has, like I said, spine has the bone, and there are discs, which is the soft tissue, very strong, cushiony stuff between the bones. Bones called the vertebral bodies, and then the disc is that strong cushion. Everything gets together with the joints, and everything gets together with the ligaments on the soft tissues and the muscles. It creates a spinal canal where all the nerve goes through. There on the neck or the upper back, there's spinal cord. On the lower back, there's no more spinal cord. It's just nerves. And it's like horsetail, which is in Latin cardiacoina, right? And so there are channels. Each level of the spine, we have 7 bones in our neck, 12 bones on our upper back, and 5 bones in our lower back. And then we number them. There are channels, and then there are big nerve comes out. From the neck, it goes to arm. From the back, lower back, it goes to legs, bowel, bladder, genitalia. So if you are having hand numbness and your back hurts, it is not connected. There is something else going on. And most of the time, everybody wants to try to find just one answer to everything.
Yep.
So what compresses the nerve? So we talked about the wear tear. So wear tear makes things doesn't do their job, right? And so when the disc doesn't do its job, then the all surrounding tissues has to compensate. And one of them is the joints, and every level has joints. So those joints gets bigger, thicker, or the ligaments get thicker.
And the hole where the nerve comes out.
Yeah, holes get smaller, or the canal gets smaller. So with the wear tear, that discs, they were really strong cushions. It's like a fluid-filled balloon over the decades. It, you push from the bottom and then it compresses and it bulges. So bulging doesn't mean that you have to get disc replacement. Bulging means that your disc is not doing the job. And then when that bulging though, if it is big enough and pushing on the nerve, they call them pinch nerves, So, and then surgeon comes in and then takes that pressure off. If it is the canal itself, we are talking about lots of nerves. And again, you cannot just go 360 degrees and take the pressure of everything. There's certain methods that we do. We can do it through the belly, from the front, we do it from the side, or we do it from the back, and then take the pressure off. And it's the same thing with the brain or the neck too. The neck and the upper back is much more important because there's spinal cord.
And it's narrower there.
Exactly. And then it's just like, so all those changes, it happened over the decades. It's degeneration. I tell them, like, you have lost arthritis. And arthritis really, just like the joints, but we have it on the back. And when everything changing over time, your body compensates. So when it's compensating, it is the muscles and the ligaments. So if it is long time, all the muscles are pissed off, then it creates the pain. It's called the muscle fatigue pain. And so that's why it's just like some people, they cannot get out of the bed in the mornings because it hurts like hell, because immobility makes it all stiff. They need to move along, then it gets better. And other people, they work all day, the pain gets worse throughout the day, and then it's just like lots of stiffness, lots of pain, because it's just like everything pissed off now. And so that's it.
I think that's really great though, because when we look at that, there's a lot of different things that can cause. So whenever we talk about decompression, we're talking about it's because of compression. And compression can be a disc bulge, it can be swollen tissue. It can be narrowing of the canal, the
narrowing on the channel.
The intervertebral foramina or foramen, depending on where we're at. So all of those things, a neurosurgeon can go in, create space, and through creating that space, protects the nerves. Now, you said something really important. You said that most patients want to get their pain treated, and yet sometimes they minimize things that are way worse than pain. So a patient comes in, one of the things that we hear a lot is patients will say, oh, it's only numbness. It's not a big deal, it's only numbness. When you hear that, it's only numbness, what's your first thought?
So it depends on where is the numbness first, right?
Let's say it's like with their hands or feet. It's only numbness, it's not pain.
So numbness is one of the jobs of the nerve, right? So there's nerves has two jobs. Say two jobs. One of them is the motor, which is the strength, and then the other one is the sensation. It is pressure, it is heat, it is cold, it is, you know what I mean? And then the numbness meaning that wherever that numbness is, there is something wrong with the nerves and causing that numbness. And sometimes it might be the nerve actually get out of the spine and it is just traveling, and then something happened, which we call neuropathy. And then you can diagnose this with those needle tests, which is the EMG neuroconduction study. And so then it will show that it's a peripheral neuropathy. So peripheral neuropathy is tiny, tiny little nerves. So there's something wrong with them because of the vitamin deficiency or
Diabetes or
diabetes,
chemotherapy
some
or-
other
yeah.
diseases or vascular diseases, everything can cause numbness. So, see this kind of pathology, and then you got to see neurologist, because when there's changes in the nerves, we cannot change the nerves.
Yeah.
So it is gone, and it is like when you start losing the function, just like having a stroke. When you start losing it and you lost it, like the weakness or the like numbness been there like forever. When you don't take the pressure off early enough, it is so hard to get it back.
Yep.
You know, nerves grows inch a month, let's say. And I first, when I do the surgery, when I say, first hopefully the strength gets better, and then, you know, pain gets better, pain gets better, then strength gets better, the last is the sensation. Sometimes you see it right after surgery, oh yeah, I feel much, much better, I haven't, you know, but sometimes it just stays there, we can't. So that's why the surgery's goal is to stopping the progression. Function, so important. Not able to walk, not able to stand, not able to sit long time. You start bending forward. There are like certain types of pain. Then you have to stop and rest. These are all flags that, oh, there's something really wrong.
Yep, they tell us different things.
That's right. And then the other, you know, it can be so many things maybe. Maybe you have a really terrible arthritis, but at this point, you gotta see a neurosurgeon. The function, I had a patient, came with the back pain, horrible narrowing in his lower spine, right? I did the surgery, and suddenly he's feeling, oh, I forgot I had a neuropathy, but the all leg weakness and, you know, function got better. Pain was still there, but, you know, it's just like, at least like if you get like up to 80% relief on the pain, whatever that you are doing with the surgery, it's a great outcome. And you got to talk all this before the surgery, and with the training differences between orthopedic surgeons and the neurosurgeons, you know, I'm sure we are talking about the same thing, but if you put 10 surgeons, spine surgeons, in the one room with one pathology, you might get 10 different approaches and 10 different ideas, because everybody is telling you what they are comfortable with, and then what they get the biggest success. You know what I mean? You know, maybe you know, Dr. A gonna say, you know what, I can treat you from all front. Somebody gonna say, nope, I gotta do it on the back. Some people say you need actually screws and rods. Some people can say, no, you don't, and vice versa.
No, it's an interesting thing, because, you know, different pathologies will present, but one of the things I remember when we were learning in school, that we'd look at nerves and pain, really important, C fibers, some delta fiber, right? But then when it goes to numbness, that's going to be potentially a worse sign. But then when it goes to muscle weakness and muscle wasting, at that point, that's a worse sign than pain. And oftentimes I think patients don't realize that. They're like, yeah, this leg, like the muscles are starting to disappear, but the pain's not there anymore. And it's like, that's a problem. And a lot of patients don't see that, because they go, pain is bad, treat pain, but if it's numbness, or if it's, you know, my muscles are
my leg is getting smaller, right? Or the shoulder, or
and they think that's not a big deal. Can you talk about why that's a huge deal?
All right, so like I said, when you lose the end point, so muscles are the end points, so nerve travels through wherever that is traveling, and it goes to muscle. When you lose the muscle itself, then there's no way you can actually make new muscles. There are some nerves, so if you have the atrophy, you know, you lost the muscle mass, there is certain nerves actually try to find other ways to make the other, maybe some left, then make it bigger, and then of course the physical therapy and everything else, just you are trying to not to lose the muscle mass, right? But it's just, and like I said, it doesn't have to be just from the spine, because lots of peripheral nerve, you know, big nerve problems, it's called radiculopathy, and it can cause different things and different symptoms. Usually like when you get atrophy, and it is long term that you have not actually
taken care of
yeah,
it, right?
exactly, taking care of it. Yeah, and it can be just like peripheral nerve. Maybe you have a tumor pushing on your nerve in your leg.
Yeah.
You know what I mean? Same thing with the arms. The nerves comes out of the spine, and then we call them plexus, right?
Yep,
so there's a lumbar plexus,
yeah.
yeah, and then sometimes they might have problems with those. Nothing with the spine, and then the function loss. Please, you gotta seek. I did a surgery today. Lady had a progressive myelopathy, which is there's a severe compression in her spinal cord. She was wheelchair bound.
Yeah.
She could stand up. She couldn't walk. She totally lost, all the strength on the legs, and then she cannot open her. 51 years old.
Wow.
6 months. 6 months, and it's just like, why you didn't go to the emergency room? Like, you cannot walk.
Yeah.
It's not just like it's just gonna go away. You are ignoring it. Yeah, it's just gonna go away. But it's just so sad.
So a lot of patients, one of the things is again, pain, they're gonna take action. But numbness or weakness, they don't take action, when in reality it should be the opposite.
That's right.
If you're seeing loss of function, that's a much bigger deal than just pain.
That's right.
Typically, right? And so it's really important to take that seriously, to seek help, to go talk to a provider, and to understand what's going on. As you said, there can be things that maybe are more benign that are causing it, but regardless, if you have loss of function and weakness, you should seek help.
That's right. It is really gets to that great point. So, because the neurologists treat the nerve diseases, and there are multiple reasons to get a neuropathy, and then they do treat them medically. So these are all benign issues, and then when it actually coming from the compression to your nerve, because everybody calls they have sciatica, right?
Yeah.
So sciatica is not just one nerve. There's everything else.
They call it sciatica, but it could be radiculopathy.
Yeah, exactly. It's just whatever. It's just like sciatica.
Leg, right?
Yeah, and so it's just like the most of the time, this kind of pain is treated conservatively.
Yeah.
And some people wanna I need to get fixed right now. I don't wanna just waste my time. And then I always explain to them, physical therapy, pain management, chiropractic, adjustments, yoga, Pilates, all the things. Change your daily activities, do like home exercises. These kind of stuff, 80% that you will not need a surgery, or you will slow down the process. If you are heavy, then lose some weight. And then if you are not eating right, you gotta eat right. And then it's just, if you have diabetes, these are all the diseases can hurt the nerves. You gotta take care of your blood sugars. It is all huge package. It is not like one thing or another.
You mentioned this earlier, that people want one thing to fix everything, but bodies are complex and systems are related. Nerves do have association with nutrition and your gut and your skeletal system. Like, all of these things are connected and they're related. And as you said, it's really important for people to listen to the providers, seek out answers, and it's not one thing necessarily. It might be, you need to do this, this, and this, and by doing all of that, it may be able to help you, but it may not, because sometimes we wait too long. So
that's right.
I want to bring up one other thing. You mentioned that about 70% of your patients that come to see you don't need surgery.
Yep.
Right? And so a lot of patients are really fearful about going to see a neurosurgeon for different reasons. One is people are fearful to go see a neurosurgeon because
they think they operate everything.
Right? He'll do surgery on everything.
As soon as we see the patient, we are offering surgery. No,
right? But then there's the other set of people that go, well, if they're not going to do surgery,
that's right.
Well, it's a waste of money to go see them.
Exactly.
Right? So
that's totally a cultural thing, though. You know what I mean? It's just because if they are seeing the surgeon, they are not seeing that as a consultation. So because they are seeing as, I am seeing the surgeon, so all my trouble's gonna go away because surgeon will fix it. And that's the huge problem I think all surgical specialties have. Because I have to spend more time with you, explain to you why you don't need a surgery. And then, or I'm gonna say, you know what, yep, you need a surgery, I can help you, there's no guarantee, 100% guarantee, but I can help you because you have this pathology causing these symptoms.
Yeah.
If I take care of the pathology, hopefully symptoms will get better. And especially, remember, we were talking about the chronic pain people. So it is, those people are depressed. This is much complex than just, having pain and then they're on narcotics and long-term pain medications and everything else. It just affects, it's just vicious cycle. So those people comes to you. I think that's the saddest thing for me to say, I cannot help you.
Because they're in so much pain and they want a fix, but they don't need any surgery.
Yeah.
Wow. Yeah. Because once you get to a surgeon, you feel like you're finally going to get answers.
That's right.
And then there are answers, but there's not necessarily a surgical solution.
Yep.
And
Most of the people doesn't like what you have to say, but some of the people actually appreciate what you say.
Yeah.
Because till they see you, they couldn't get an answer. They didn't understand what was wrong with them. People comes to me with their like MRI reports and then want me to explain everything to them. What does that mean? And when they talk with their providers, because provider doesn't know what that means, and like I said, you have 3 pages of things wrong with you, but actually it doesn't mean anything for you or your pain. Some of them does. That's why we take care of those some, but it's just not everything fixable. I like brain more because, if there's a tumor and then when you talk to patient, okay, so I have to do surgery, it's gonna kill you. And so I do surgery went fine, and then those people are very appreciative. It's just more complex, more high risk. Just like we talk about the trauma. And with the degenerative spine diseases, there's a big market. There are orthopedic spine surgeons, there are neurosurgeons, there are complex spine surgeons, which could be orthopedic surgeon or neurosurgeon. And then those complex spine surgeons, they treat deformities, right? Like the scoliosis or kyphosis. Scoliosis is your spine going sideways. And then the kyphosis, you are falling forward. And this kind of deformity is that causes the pain, and then those people treat the pain. But I never seen anyone as soon as see the patient, okay, let's do the surgery. Unless like it's really, really bad.
Unless it's trauma.
You gotta, when it is going for many, many years, you still have higher chance to at least get rid of some of the pain with the physical therapy and pain management and the chiropractor and all the stuff, conservative management, rather than actually the surgeries. And those surgeries are incredibly big surgeries. So big surgeries mean high risk, high complication rate, everything else. So, but if there's the right indication they need that, they do incredibly well. And about those people, they are small percentage. We are not talking about 100 people having pain. Everybody have the same thing.
Well, so you're obviously very passionate about this. Like, where does that come from? Where did you first start to get really passionate? I know that you mentioned when you were young and you went in to see a neurosurgeon.
You have your call. It's just like it is. When you decided to become a doctor, it is all about to try to help people. And when I follow up with my patients, I want to see happy faces. I cannot make everybody happy, but at least I want to see most of them happy. And then it is the gratitude. It is not for money. It is not, then you shouldn't be a doctor, right? We work long hours, we do everything.
Lots of school.
I never seen my daughter growing. I was working, and or my son, it's just like it is older you get, you are kind of seeing the balance, family and work balance stuff. So important. Neurosurgeons has the highest rate of divorce because, they don't see each other. They grow apart with each other. And
just because you're so busy.
It's just you are so busy. And then, so you have to justify what is your priority. Some people love their job and then care about the people. They want to help. And that's why you become a neurosurgeon. That's why you go to school. That's why you do all those trainings. And if you don't, you cannot do this job.
So what is your recommendation on, as a neurosurgeon, for finding the right work-life balance?
It is all in you, with you, and you gotta be aware of, like I said, what is important, what is the priority in your life.
Yeah.
Job is a job, and you're always replaceable. Family, peace, you cannot get those back if you lose them. So, and you know, it is sacrifice that you do. I think every people in healthcare does that.
Yeah.
You know, if you don't find a balance, you will lose your mind. It's dark. It is saddening. There are good news. There are lots of bad news. You know, this stuff.
I like the word work-life integration because you have to find a way to integrate the important things in your life.
Yep.
That doesn't necessarily mean more or less of one thing. There's times where work requires you to be gone. But that means that you need to make even more importance and create even more quality time with the time that you have when you're with your family, right? I feel like
That's
it's so easy that when you're in a high-stress career, you go home and you're around your family, and the one thing you want to do is, I want to relax. Like, let me be on the phone.
That's right. That's right. No, you gotta figure out, because it's just like, before actually we talk about the social part of this, I wanted to actually tell you something. So, the spine surgeries, they suck. So the success rate of the spine surgeries is higher if there is a right indication.
Of course, yeah.
Right? So we see lots of failed back surgeries, right? And so, or people just have like 3-5 surgeries and they did not get better. So all those people with the failed surgeries, they need to understand what failed.
Okay. And what is it that failed?
Maybe the indication was wrong. You know what I mean? Or it didn't work.
Yeah.
You know, it's just, I see patients with almost normal MRIs or scans, imaging studies. They have 10 out of 10 pain. It is, you know, because everybody responds, whatever that happening, totally differently. So you cannot put everyone in the same group. And then every surgery is in the same group. You know, when you need a surgery, you start talking with your neighbors. Oh, you had a back surgery. What you had?
How'd it go?
Oh, I had. Yeah, how did it go? Are you doing okay? You know, they trust their people more than you if you weren't successful enough to connect with those people. As a surgeon, like I tell them, you know, it's just we are family now. And then you have to trust your surgeon because you are giving your body and that's your life. That's your body. So some people is comfortable with you. Some people is no, there is just, it is not connecting. Go see someone else. You know what I mean? There are so many people, there are so many surgeons. You didn't like one surgeon said, or you didn't understand, and then you always can go to other one. Get the other opinion.
Neurosurgeons are one of the only doctors that I ever hear say this. Almost every neurosurgeon I talk to says that for patients, it's like, you should get 2 or 3 consults. Meet 2 or 3, find the one that you feels right for you because it's a big deal and you need to trust them.
You have to.
Most other docs are like, no, like you need to see me. But neurosurgeons are like, find what fits for you that you're comfortable with because it's so important to get it right. If you don't believe you're at the right place, you might not have as good of an outcome just because you don't trust the person to the degree you need.
And then your expectations are totally different. And it is almost like a marketing. So you are trying to sell something to customers. it's so wrong. You want to take care of the patient.
Yep.
And you want them to get better.
Absolutely.
And you want them to feel comfortable with you that you are or you are not going to take care of their problem. And then it all comes from the education. The way that you talk, way you interact with each other is most important thing. If I feel like, you don't have any, like you are not feeling the trust, it is, then I back off. I am like, you know what? Why don't you go home and think about it? And I'm gonna write you all the, like what I'm telling you in the summary. You can Google it, you can try to understand, or you can go to another surgeon. Some surgeons are really aggressive. They wanna fuse, they wanna, it's just like they wanna do big surgeries. They believe that those big surgeries is the answer. But some surgeries, you do not need those big surgeries. And so you just gotta find the right thing for the right patient.
Absolutely.
And then they will feel much, much better. They feel understood, you know what I mean?
Yep.
On the pain, chronic pain patient, it is so hard to get through them because they've been suffering so long and then they want to get fixed. And then when you tell them, like I've been doing this very long time, and I have patients just left or start increasing their voice. They don't like you and they dismiss you. They get irritated. They get frustrated. And it's just like you just sit there and they leave.
Yeah. Well, I think that's one of the hard things is you want to help every patient that walks in. And as you said before, sometimes the people that are the most frustrated are the ones that you can't help. But that's also, I think people don't realize, that's also frustrating for the doctor.
Yeah.
Right? Because you wish you could help them. They're in pain. That's what we go to school for, is to help people.
Yeah.
And when you can't help them, it's incredibly frustrating. But in the end, there's many people that we can help, especially if we work together across specialties. And that's something that I find that's really, really important. Whether you're a pain doctor referring and working collaboratively with a neurosurgeon, physical therapy with primary care, chiropractor with a pain doctor, regardless of the combination, it's really important to create good communication lines, because that's what's in the best interest of the patients. Is when doctors talk, patients win. I truly believe that. And so, one of the reasons we do this podcast is to create that dialogue, to educate patients and to see how we can bridge these gaps. So one of the things, I asked you this a moment ago, and I want to transition slightly on this one. I talked about, where did you first get passionate as a doctor, and you answered that. But I'm curious, if you weren't going to be a pain doctor, what would you be?
But I'm not a pain doctor.
Sorry. If you weren't a neurosurgeon, I apologize. Yeah. You see what's in my head, right? No, if you hadn't become a doctor or a neurosurgeon, what would you have been?
I actually don't know. I have no skills but be a neurosurgeon. I can cook. I love cooking.
Okay.
But I don't know if I can be a chef though. So you gotta get better and best at what you do.
Yeah.
So if you're gonna be average, you can do anything, I guess. So I married to a car mechanic. He's incredible. He knows everything about the cars, right? And he builds cars. And then it's the big cars, the RC cars. And he's so smart, like engineers. I don't know if I have that kind of mentality, you know what I mean? And then, or like the business part. I think it's so boring. It's a total different thing, right?
Yeah, it's a different feeling.
I like to fix it with my hands. I touch people, I hug people, I talk to people, and yeah, I don't know. I really don't know.
I think you said something so wise. You said, if you want to be average, you can do anything.
Yeah.
But if you want to be great, there's only a few things that you really can be great at. Find those things.
Yep.
But you have to be willing to pay the price. Because to be great at something, you can't just put in a little bit of effort.
That's right.
To be great, you have to put in as much effort as it takes to be great. And so again, as far as life advice for people, I just think that's so awesome. If you want to be average, do whatever you want. It doesn't matter. But if you want to be great, there's probably a few things that you have special talents to be able to do. find it, embrace it, work towards it.
Yeah,
don't give up.
hopefully find it though.
Right.
Because
people don't.
some people stop looking, right? It's
Yep.
just like it is 9 to 5 job and paying the bills and
Yep.
take care of the family, and then so many people that are not happy what they are doing, but it's paying the bills.
Yep.
So
And sometimes
it's
they
tough.
can't get
It's
away from
tough.
paying the bills enough to do that, because we do live in a world where sometimes we have to give up what we want for what we need. And in that moment, like if you have a family and if you have people that depend on you, it may be, I have to work right now doing this, even though I'd love to go be great at this.
Yeah.
I have to do this because I have to provide the bills. And so I do think that as people pursue dreams and careers, it's important to early put in the effort, put in the investment in time when you don't necessarily have the same responsibilities and duties on you, so that you can find what you're great at.
Mm-hmm.
Because if you wait, you may not have the time that you hoped for
That's
down the
right.
road, right? And I think that goes back to, if we bring this back to medicine for a moment, that's exactly why when we're working with patients, why it's so important that if you have an issue, if you have neuropathy, if you have numbness and tingling, and it's small, go get answers early, because
Yeah.
at a minimum, you at least know what's going on, and if it's nothing, you know it's nothing.
Exactly.
You can sleep back well at night.
Yep.
But if it's something, it's always easier and cheaper to fix things early than it is once they've degenerated and become so bad that it has to have surgery,
Yeah.
right? And so,
And sometimes you might not get answers. Sometimes it's just you have those things, but all the workup is not showing anything. And that time, I think this is the most frustrated and irritated people, because they had seen 10 doctors, and then the approach is like, nobody knows what's going on with me. And then that's the most, I think, toughest ones. It is not, you cannot be smartest kid in the class when this comes to it, right? Because it's just like, there's nothing, it's actually there.
and that's hard. Like you mentioned this, when the MRI is perfect,
Yeah.
but they're in a ton of pain, and they've been to 10 doctors and nobody knows what's wrong. Well,
Yeah.
why? It's because everything's coming back showing it's normal, but that doesn't mean that you're not in pain.
Yeah.
It just means that it's not an obvious reason.
Yeah, and then you got to educate them about the psychosomatic things, right? And then everybody, when you start talking about if it is coming from your psyche, when you talk about the psychiatrist or psychologist or whatever, now are you going to call me crazy?
Yeah.
So it is not craziness actually.
Yeah.
That's a real disease,
Yeah.
and then that's really may be treatable in certain cases,
Yeah,
right?
it can be.
And then it's just like you never ever checked out that possibility.
Yeah, when people can be offended when you say the pain's in your head, and there's a difference between this is a psychological issue
Yeah.
and it's not real.
That's right.
Saying that it's psychological doesn't mean you're discounting the fact that
Yeah.
it's real pain and suffering. It's a matter of saying you need somebody that can treat the psyche to
That's
be able
right.
to treat this
Yep.
issue. And it's more of a direction towards specialty than
Yep.
it is a discounting of one's condition.
That's right.
Yeah, and I think that's an important distinction that a lot of people miss, is that there is especially around addiction, we obviously treat a lot of pain.
Yep.
And there is a lot of psychological involvement, both with pain and with addiction,
Yeah.
involved in patients that we work with. And so I think that's very well said, as far as making sure to counsel patients that just because there's nothing physically wrong with you doesn't
Yeah.
mean that it's not a real pain, and
That's
that
right.
you should feel bad about going and seeing a psychologist or
Yep.
a psychiatrist.
So whatever. It's just like of course it's all exclusion and everything, but if it is gonna help you, like people with fibromyalgia, people
yeah.
with the pseudo seizures, these are all psychosomatic stuff, and it is not because you're crazy. It is real. You are feeling it, and then there are ways to treat those things. So you cannot just rule out. It's just like, oh, what are you saying? Now I'm going to be in pain all my life. And then there are so many depressed people.
Yep.
They lost their job. They feel the pain.
Yep.
And it is just, I wish I would have each one of them, but I can't. And just only thing that I am sympathizing with them, I will never know how much pain they're in.
Yeah.
But at least it's just like, if there was something,
You
of
would
course,
do it.
I will help them. I will
Yeah.
try to help them,
Yeah, well, if you say you can't help them, it's not because you don't want to.
That's right.
You absolutely want to.
Yep.
But sometimes you can't.
Yep. Sometimes you can't. So, you know, and then I said it many times, I don't think surgery will help you. I don't even know what kind of surgery will help you. And you do not want to have the surgery.
Just to have a surgery.
Just to have a surgery, because if it is not going to help you, then maybe you're going to be worse. Then what?
Yeah, then you're going to have your issue plus.
Exactly. Plus now, exactly.
Pain. Yeah.
And every surgery has its risks.
Yep.
Every surgery has its complications and risks. So it is very important to listen what your providers are saying. I am, like, as a surgeon, that I have seen thousands of people like you. I've been doing this 33 years.
Yeah.
I started medical school. I did neurosurgery in 1993.
Wow.
So thousands of people. And I have a little bit inside that I know what will make you better, or you will be better.
Yeah.
You know, there are lots of advancements. You know, maybe one day there will, you know, there are disc replacements, right? It's just like someone successful, someone not. There will be maybe some injections in the future. They are doing the stem cell research and everything. You know, maybe 10 years from now, those things that we couldn't figure out how to.
There are now solutions.
Yeah, maybe there will be solutions.
Yeah, that's
you
well
know?
Said.
Yeah, it's just like this technology
is advancing.
Just because there's
not an answer
now
doesn't mean that there will
be no answer. Yeah, they are treating spinal cord injuries. You know, 20 years ago nobody could do. There are so many things happening in the world, so many advancements.
And I think to your point about depression, that's why there's always a reason to hope.
Yep.
Right? Like, don't lose hope just because we don't have a solution now.
That's right.
Doesn't mean there might not be a solution in the future.
Yep.
And I think that's a great message. So let's do this. As we're wrapping up the interview, for patients that are in pain, they're seeking answers, what would you say is your best advice that you could give to patients out there that don't know where to turn?
What kind of pain they have?
Let's say back pain. Let's say back pain, most common form of pain that we see.
Like I said, back pain, primary care physician.
Yeah, start there.
Start from there. Yeah. You don't have a primary care physician, you can go to urgent care. You know, you gotta.
But do something.
Do something about it, right? And especially like most of us, we think that if we don't pay attention, it's gonna go away. And usually, like so many back pain, it is musculoskeletal, right? It's just like, it is literally, you take ibuprofen, Tylenol, it goes away. It is not bad all the time. There are good days and there are bad days and all the stuff, so people tend to wait. And then it's just fine. You know, I've seen so many people I treat myself because, you know, I've been doing surgery forever and ever. Yeah. You know, I have neck pain, I have back pain, and then so I have to take ibuprofen here and then I will. Yeah. And, you know, but I know the certain things, like, you know, I will try to be active and I will try to lose weight and change things that, you know, I don't jump out of the airplanes and I don't do roller coasters because, you know, I know that it's just like I am getting older and then I need to take care of my body now. And so first, like I said, urgent care, primary care physician, back pain, and then if, you know, they will give you anti-inflammatory medications. You know, most of the people are aware of the narcotic addictions and everything, so most of the people doesn't want to use the narcotics. And so anti-inflammatory is much, much better than narcotics. Yeah. And because what narcotics does, it is not actually treating the pain, it is making you feel better with the pain.
Yeah, it's the opioid receptors.
Opioids, yeah. Yep. So it is, you know, it's just like what it's treating is Tylenol on the Percocet or hydrocodone or something, or ibuprofen, or, you know, you always try the anti-inflammatory and you always try the muscle relaxants. There are tons of medications, not narcotic. It can help you.
Absolutely.
And if you have pain everywhere, so maybe you need to see a rheumatologist. You know, maybe you have problems with your joints or connective tissue or something else. But it is always, it's triage. Yeah. So your doctor kind of can think of.
Which is why your recommendation is, if you're in pain, go talk to a doctor.
Exactly.
Take action, let them triage and get you to the right place.
Yep. And then, you can get an x-rays. You don't need an imaging right away, but if you have the pain, but it is associated with the other symptoms, like you are peeing, pooping yourself, you are numb, you are weak, you can, issues, all those stuff happening, you gotta go to the ER.
It's an emergency,
And especially, most of the people, that's the other thing actually, is the accidents, car accidents, right? So they didn't have pain, they say. And then most likely they didn't. It was on and off, right? And so the high energy traumas can bring out the pain. So you had all those problems before and you never get imaging, so we don't know if it is pre-existing, right? And then, but trauma can exactly. And then it is a terrible thing. It's just now, then what you do, you go to doctor. Then get some imaging, see what is going on, figure out what is causing the pain or what is causing the other symptoms.
I think there's a lot of wisdom in that, in the fact that focus on what you can control.
That's right.
If you're in pain, don't ignore it. Don't sit there and do nothing. Don't be a victim to your pain. Take action, find answers, talk with doctors, sometimes multiple doctors. Because ultimately, if you take action, you're going to be in a much better place than sitting and hoping that it will just change on its own. Right? So, fantastic advice. Thank you so much for coming in, Doc. It's been an absolute pleasure to hear some of your story, how you're helping patients, and it's been so fun to have you on Doctors Unscripted.
Thank you. All right.
Thanks.